Illness assessment helps you find and report medical problems that affect the patient's health and may aid with treatment. You'll assess the patient by asking questions and by checking the patient's breathing, pulse, temperature, and skin. In class with your instructor, you'll practice an illness assessment on a healthy person. Assessing a healthy person may help you recognize differences later if you assist an unhealthy person. As you've learned, you start with primary assessment. After giving the responder statement and assuring that the patient is responsive and breathing normally, get something to write on so you or someone assisting you can record what you find. There is an illness assessment record sheet in your participant manual. To help you remember how to begin an illness assessment, use the mnemonic SAMPLE. The S in SAMPLE stands for signs and symptoms. A stands for allergies. M stands for medications. P stands for pre-existing medical history. L stands for last meal. And E stands for events. The S stands for signs and symptoms. Signs are something you, the rescuer, sees. Symptoms are something the patient tells you he's feeling. Ask the patient how he feels and what happened right before getting ill. Ask, how do you feel now? Next, you'll check the patient's pulse. Find the pulse on the patient's wrist. Feel the pulse with your fingers, not your thumb, and count for 30 seconds, then multiply by 2. The typical adult pulse rate at rest is 60 to 80 beats per minute. Next, you'll check the patient's respiration. As you do this, remember the typical adult breathing rate at rest is 12 to 20 breaths per minute. Someone breathing markedly faster or slower may have a medical problem. To check the breathing rate, watch the patient's chest or place a hand on it while timing for 30 seconds, then multiplying by 2. Attempt to check a patient's respirations without them knowing you are doing so. Listen for wheezing, gurgling, or high-pitched noises. Note if the patient complains of short breath, dizziness, lightheadedness, chest pain, or numbness, or tingling in the arms or legs. Next, check the patient's temperature and moisture. Feel the patient's forehead with the back of your hand. See if it's warm, hot, cool, moist, clammy, etc. Check the patient's color. Is it pale, ashen, reddish, bluish, or yellowish? Does it have blotches? If the patient has dark skin, check for color change in the nail beds, lips, gums, tongue, palms, whites of the eyes, and earlobes. Usually, an adult at rest should have skin that's warm and dry to the touch. Noticeable changes in temperature, moisture, and color may indicate problems. Next, check the patient's eye pupils. Are they enlarged? Small? Unequal? Any of these may indicate problems. Also in the mnemonic SAMPLE, the A stands for allergies. Ask the patient about allergies to medications, insects, food, or the like. Ask the patient, have you been exposed to something you are allergic to? While talking to the patient, look for medic alert bracelets. Has the patient been bitten or stung by an organism? If so, and the allergic reaction is severe, treat the severe allergic reaction as a medical emergency and follow primary care procedures. A severe allergic reaction, anaphylaxis, can be treated by epinephrine. People who have suffered a prior episode of anaphylaxis often have prescribed an auto-injector of epinephrine. Have the patient use the auto-injector or assist them with its use. Next, the M stands for medications. Ask the patient if he takes any medications. If so, ask, what medication do you take? Did you take it today? How much did you take and when? If possible, get the patient's medication so you can turn it over to emergency medical personnel when they arrive. The P in SAMPLE stands for pre-existing medical history. Ask the patient if he has any medical conditions like asthma, epilepsy, heart conditions, or diabetes. The L in sample stands for last meal. Ask the patient, when did you last eat? What did you eat?
And any other events that you could think of that led up to this?
The E in sample stands for events. Ask the patient about or note the events that led up to the illness.